Did you know that in menopause, cholesterol levels will tend to rise not just because of decreasing levels of estrogen, but also because of another factor that you have complete control over? Hi, and welcome to the Wild Wisdom Show. I'm Dr. Patricia Mills, holistic medical doctor transforming women's hormone health with natural root cause solutions. And today we're going to be talking about why cholesterol rises in menopause more than just low estrogen. So, this is a very important topic because heart attacks and strokes become the leading cause of death in women over the age of 50, to the point where it accounts for as much as 45% of all deaths globally in this age category. And the concern is that one of the potential markers of an increased risk of heart attack and stroke is increase in cholesterol levels. Now, what we know is that the declining levels in estrogen in menopause tend to cause shifts in our cholesterol, and not in a good way. So our total cholesterol levels will tend to go up. Our LDL cholesterol, which is considered the bad cholesterol. Now, I say that in mental quotation marks because cholesterol isn't necessarily bad. I've covered this in another episode. I'll be giving you resources on this before. But in general, when we have a shift in LDL going higher and the other kind of cholesterol called HDL going lower, we tend to increase our risk for developing heart attacks and strokes in the future. And so with menopause, we do get an increase in total cholesterol. There's an increase in LDL, a decrease in HDL, and also we can have an increase in our triglycerides, which is the number of fats in our blood. So this is very key, and a lot of people are focusing on this. The problem with this is it feels less empowering because, there's a thought that there's not much I can do about these declining levels of estrogen. It's just going to happen when I get into menopause. So do I just accept this increase in cholesterol, and do I have to take medication for it as a result? And the answer is no, not necessarily. And here's why. Because there's another crucial factor that is causing the cholesterol shift as we age, and that's called inflammation. Now, inflammation is super fascinating because the link between inflammation and cholesterol is just being recently understood better by scientists. And essentially, when you have inflammation going on in the body, and that can be like a low grade inflammation that's, low level, not very, very obvious. It may show up as changes in your skin, skin aging, maybe some rashes on your skin, maybe hair loss, brittle nails, aching joints, aching muscles, osteoporosis, osteopenia, changes in your brain function. Inflammation can show up in many different ways. And one of the ways that it can show up is in changes in your cholesterol in a very negative way. And there's actually several mechanisms through which inflammation will increase your cholesterol, and it's through interconnected pathways. So let's cover what that looks like. When your body detects inflammation, and we will be going into what causes inflammation in your body, your immune system is activated. It springs into action. And this triggers changes in how cholesterol is processed, which is actually quite fascinating. One key mechanism they've discovered is that inflammation activates these molecules that are called toll-like receptors. And when these TLRs, for short, are activated, this slows down the removal of cholesterol from cells, and this can lead to a buildup of cholesterol, and this further fuels inflammation. So it creates this vicious cycle that inflammation causes a buildup of the cholesterol builds up and causes more inflammation, and so on. The other pathway is that inflammation alters the way that the good cholesterol, HDL, also known as high-density lipoprotein, functions. So normally, HDL, what it does is it removes excess cholesterol from the system. However, inflammation can decrease the levels of HDL and make it less effective at its job. Again, another way that causes buildup of cholesterol in the blood. So very, very important factor. Inflammation can even change how your body controls cholesterol at a genetic level. And the downstream effect of those genetic changes is that it'll cause your liver to make more cholesterol. So it doesn't even have anything to do with how much cholesterol you're eating or taking in through your diet. More about the fact that inflammation, one of its effects in the body is that it causes your liver to make more cholesterol, which is absolutely fascinating. Inflammation also changes the existing cholesterol that your body has made or absorbed from the diet, and it damages that cholesterol in a way that is called oxidized. So it oxidizes the cholesterol, which generally tends to make that cholesterol harder and denser and more likely to build up in those plaques in the blood vessels, also called atherosclerosis. And it's those plaques that can eventually cause that increased risk of a heart attack, which is when the plaque blocks blood flow to the heart, or a stroke, which is when the plaque blocks blood flow to the brain. So inflammation seems to be an extremely important factor when we're considering the link between high cholesterol and menopause. Now, why is it that we're experiencing inflammation? And most of it actually has to do with lifestyle factors. So let's go through a few of these lifestyle factors. And the good news about this is that it's completely within your control to modify these factors and thus decrease the inflammation in your body, thereby decreasing the risk of the heart attacks and strokes. So let's go through this. Number one is diet. And we now know conclusively that the Western dietary pattern, we call this the Western dietary pattern, but many other countries have adopted this way of eating. So now we can call it a very global dietary pattern, which is essentially a high intake of processed convenient foods and snacks and breakfasts, etc., and beverages, as well as increased consumption of sugar and low fiber consumption, so not enough vegetables, have been associated with increased inflammation. In contrast, a diet that's rich in whole grains, so not necessarily bread and pasta, but things like oats, quinoa, sorghum, teff, millet, even rice is considered a whole grain before it's been processed into a flour. Also fruits, vegetables, and omega-3 fatty acids, which are generally from green leafy vegetables and fish, all have anti-inflammatory effects. In other words, a Mediterranean style diet or a traditional Asian diet, not how things are necessarily done now, but how things were done around 100 years ago before we started having these highly, palatable ultra processed foods that have been sneaking into our diet, including the oils. Now, lack of physical activity is a well-documented risk factor for systemic, which means whole body, chronic, which means it's been going on for some time now, inflammation. Obesity in particular, when it's accumulating around the belly, belly fat, also known as visceral fat in scientific literature, seems to be a major driver of chronic inflammation. Interestingly, the fat that accumulates around the belly behaves differently than the fat that accumulates around the arms and the thighs, for example, in that it's more likely to make inflammatory chemicals, which then go on to do things like change your genetic metabolism of making cholesterol in the liver, affecting the cholesterol that's present, turning it from good cholesterol to bad oxidized cholesterol, and so on. So that's a very important key factor. And obviously, physical activity, diet, obesity, and belly fat are all interrelated. So addressing one or two of the lifestyle factors can also probably help with things such as belly fat. And I have covered belly fat in depth, and you can check it out on my YouTube playlists. I have many playlists on many different topics, and I have a specific one on belly fat with many natural root cause solutions for you to dive into. Smoking and excess alcohol consumption are well-established triggers of inflammation. So a little bit of alcohol seems to be even potentially protective if it's, a wine, for example, but as soon as you start getting into the too much range, it has an opposite effect, very inflammatory effect. And some women are over consuming alcohol, especially as we age, our tolerance to alcohol goes down, and we're not necessarily decreasing our alcohol consumption to match our liver's ability to detoxify and get rid of the alcohol. So over time, what used to work for you may no longer work for you. Smoking in any form, at any time, in any amount is very inflammatory, so needs to be avoided at all costs. Now, chronic mental psychological stress has been shown to increase inflammatory levels, and it does this by triggering the release of these molecules that are very inflammatory in the body. They're called cytokines, and these cytokines go around and damage the tissues in that way that inflammation can do. So we want to make sure that we're, aware of our stress levels, aware that managing stress is an important piece in the equation of decreasing inflammation. And it also is important in decreasing cholesterol levels itself. I've done an episode on that also. So we're going to be putting some really key important resources for you in the caption below that will give you very quick fixes natural root cause solutions for all of these things that can contribute to high cholesterol and inflammation. Now, interestingly, exposure to environmental pollutants and industrial chemicals, even stain resistant, even things like the chemicals that you put on your fabrics, like your carpets, your upholstery, to resist stains, has been shown to cause damage internally and inflammation. Certain cosmetics that you put on the skin. And so these are all things you have to think about: is how natural is my environment? How much can my body tolerate from these environmental pollutants and chemicals that are coming in either through exposure on the outside or on the inside of my house? And sometimes our internal home is more damaging than the environment outside. So really, being aware of all of these things so that you can reduce your risk. I've covered this on another episode. Examples are nonstick coating on pans when you cook with the cookware has been shown to increase cholesterol as well. So all of this needs to be taken into consideration. And over time, as you integrate this into your lifestyle, you should see very positive shifts in your cholesterol levels and inflammation. Now, why does inflammation worsen in menopause? And this has been shown as well. And essentially, it's for a few different reasons. Number one, it's accumulation over time. So yes, it seems to be menopausal, but also as we age, right? So we hit menopause at certain times of our life, and menopause is happening sooner and sooner for many women. And it may be because we are being exposed to all of these factors earlier and earlier in our life, and it's precipitating changes in our body sooner. And these changes seem to be negative. So all of these lifestyle factors, when we're younger, we have more resilience to them. But the same diet that your body could tolerate when you were younger, the same amount of alcohol, the same amount of exercise, as you get older, that changes. It can't tolerate that lifestyle anymore the way that it used to. It's like the elixir of youth has run out. And now we have to double down on the lifestyle factors to counteract those effects of aging and the loss of resilience to those lifestyle factors that can cause inflammation as we age. And of course, yes, there is that declining estrogen level. Estrogen is very anti-inflammatory, the good kind of estrogen. And so what you want to do is you want to protect your estrogen levels as much as possible. And interestingly, when we get into menopause, our ovaries can make a little bit of estrogen and progesterone. Our adrenal glands kick in and become one of the major producers as well. And that stress effect, that stress response becomes very, very important, because if we can protect the functioning of our adrenal glands, which are responsible for that stress response, not overwhelm them with a stressful lifestyle, either with physical activity being too low or too high, the diet activating the stress response, like that Western diet really activates that inflammatory stress response. You want to make sure that we do all of these things in combination so that you can reduce your inflammation and counteract the effects of those declining estrogen levels and protect the estrogen that you still have. So what can you do? Again, it's really about doubling down on the lifestyle factors. And remember, that doesn't mean eating less and exercising more. In fact, undernourishment can be a huge issue in women as they age, and they think that they need to eat less to maintain the weight that they had before. And that is not what I'm talking about. I'm talking about quality, nutrient density, replacing convenience foods with wholesome foods, replacing quick on-the-go snacks with things like fruits and nuts, reducing those simple sugars, reducing the alcohol intake, making sure you prioritize sleep, making sure you get enough exercise, get outside, get fresh air, start looking at the things you're putting on your body or using in your home, just doing a general lifestyle assessment. Menopause is a time when it can be a wake-up call to us that we need to reassess things. We need to clean things up in our lifestyle. And if we don't pay attention to that call, if we don't tune into that inner wisdom, we are going to continue to suffer, and menopause will be a worse experience than it has to be. So I really hope that this helps. Check out the captions below. I will put a link to my high cholesterol playlist where I go through all of the different root causes and natural solutions, including the best exercises, specific nutrition, supplements, and I'm even going to address hormone replacement therapy, because I need to look at this in a holistic way. And replacing estrogen is something that many women are considering. So I will go into the research on this in my next episode. If you're catching this as a replay, that episode will already be available in the high cholesterol playlist. If not, stay tuned for next week, where I will go deep into Does hormone replacement therapy work for high cholesterol and reducing inflammation in menopause? I hope you found this helpful. If you did, please subscribe to my YouTube channel, Dr. Patricia Mills MD, or at dr.patriciamills. That is the best way to support the show. Also, share this episode. Sharing is caring. You never know when someone's going to benefit from this wild wisdom. I hope you enjoyed this. Have a wonderful rest of your evening, day, or night, depending on you catch this, and I'll see you next time. Bye now.